What is going on, guys? Welcome back to another video, and today we're talking about cognitive disorders. So without further ado, let's just jump straight into it. Now, cognitive disorders are a form of mental health disorders that primarily affects an individual's cognition. This is the part of the brain that deals with complex behavior, including memory, perception, problem solving, learning, language, social intelligence, and attention. Now, cognitive disorders tend to be diagnosed either as mild or major based on the severity of their symptoms. So we're going to look at a few of them and you'll see what I'm talking about. Cognitive disorder number 1, mild cognitive impairment. Now, mild cognitive impairment is when an individual gets older and begins to experience problems with their thinking and memory. The risk of developing mild cognitive impairment increases as a person ages. Conditions such as diabetes, depression, and strokes can increase the chances of developing this disorder. It's also important to note that unlike other cognitive disorders, those with mild cognitive impairment can still take care of themselves and perform their daily activities. Cognitive disorder number 2, attention deficit disorder. Now, ADD is when an individual has excessive issues with their concentration and attention. Those diagnosed with ADD can be impulsive, which can lead to issues with their social interactions and engagement in general. Anxiety and depression can sometimes be accompanied by ADD, and this condition appears to be more common in girls than boys. Cognitive disorder number 3, epilepsy-related cognitive dysfunction. Now, epilepsy is a disorder of the brain that is characterized by repeated seizures. And for those who don't know, seizures are an uncontrolled, sudden electrical disturbance of the brain that can cause changes to your behavior, such as your consciousness, your feelings, and body movement. Now, this sudden change in electrical activity in the brain can also lead to memory problems, especially if the seizures happen frequently. Cognitive disorder number 4, traumatic brain injury. Now, this happens when the brain is involved in some form of traumatic event, such as a severe blow to the head or a severe injury that causes the brain to experience damage. So, for example, someone jumping off the roof of a building or, getting knocked on the back of the head by a heavy object. Now, memory loss is a common symptom from traumatic brain injury, and it can last from anywhere from a few minutes to several weeks to several months and even years, but it depends on how severe the damage is from that brain injury. Cognitive disorder number 5, Parkinson's disease. Parkinson's disease is a cognitive disorder that causes unintended and uncontrollable movements of the body. This includes shaking, twitching, and jerking around. It can cause severe balance and coordination issues as well. Now, some Parkinson's individuals report experiencing mild cognitive impairment, such as issues with their concentration, completing tasks, memory issues, and processing information in general. Cognitive disorder number 6, dementia. Now, dementia is the main type of cognitive disorder that many of you are familiar with, and it is used as a term to describe the loss of cognitive functioning, thinking, remembering, and reasoning to the extent that it interferes with a person's daily life. Now, it's important to note that it is a progressive disease, which means symptoms may appear mild at first, but will progressively get worse over time. Now, dementia is a disease that damages the nerve cells in the brain, and these nerve cells are responsible for sending messages and communicating from one part of the brain to another. Now, as many of you are aware, there are many different types of dementia, such as Alzheimer's, which causes issues with memory, thinking, and perception. Dementia with Lewy bodies, which leads to problems with movement, sleep, and even delusions. Vascular dementia can lead to issues with planning, making decisions, and organization. And frontotemporal dementia can lead to changes in a person's personality and them experiencing difficulties with language. But there you have it, 6 types of cognitive disorders that are most common in our population. Let me know what you think of this topic down below in the comments, and if you want more videos on psychology and any further breakdowns, don't forget to subscribe and hit that notification bell. I will speak to you guys in the next one. Take care. Peace.